Morning, everybody, and welcome to another episode of the Raad Life. Today, I have a special guest on, a friend of mine, Dr. Faisal Qazi, who is a neurologist here in Orange County, and he has decided to throw his hat in the ring for public office, running for the City Council in Fullerton, District 2. So Fullerton is a districted city, and so he's running for District 2 in Fullerton. I want to bring him on. Really interesting conversation, I am sure, will ensue here. Very nice gentleman who has a lot of articulation on what he stands for and what he has been involved in his capacity as a physician, but also has been involved in community outreach programs and so forth. So let me bring Dr. Faisal on. Let's see where he is. Dr. Faisal, are you there?
Yes.
How are you? Good morning.
Good morning. How are you?
I'm good. So I was saying that for some odd reason or the other, you decided to throw your hat in the ring for public office in Orange County because you're not busy enough, right? You're and we'll get to that. We'll get to that. You're a busy guy and you're involved in a lot of stuff. But I always find it fascinating when people say, I have a need to run for public office, and I always want to know what made them get to that point. And sometimes it's not a sudden thing. Sometimes it's something they've been thinking about for a while, and trying to figure out. And maybe if they have attempted to do things without being in that capacity or that role, and now they feel like it's time for them to step up into that level. So, but before we get to that exciting stuff, what I would like to do, if possible, is just, if you can take a minute, please, and introduce yourself to our audience and tell them, what you do and how long you've been doing it for. That would be great.
Yeah, thank you. First of all, thanks for having me. My name is Faisal. My name is Faisal Qazi. I'm a neurologist. That's my daytime profession. I've had a fortunate blessing to spearhead and co-found a large neurology specialty group. So that makes me a healthcare business owner. I'm a husband. I'm a father of two former foster youth, and currently a minor placed in foster care with us right about when the pandemic began, actually. And then we have a toddler of our own who's now just turned 2. I have a long track record of community service. Public office is something that I had not really thought about, or wasn't something I was considering. But being active in the community in terms of doing grassroots work, in terms of doing social service drives, food drives, toy drives, helping the local nonprofits, having served on a commission in my city that invests in nonprofit, which is a community development commission, and having had a deep interest in policy work. One of my desires was to keep finding ways to scale up my activism, or my active work for the community to a level where I can continue to help more and more people, which I think governance at a legislative level allows you to do. But I think for me, the really critical thing was that the pandemic changed everything. Because one way is that, number one, as a public health professional, as a health professional, we got hit with a public health crisis that's unprecedented. That, along with that, came secondarily a economic crisis of Great Depression level that was unprecedented. And then also the social transformation, the social crisis that came at the heels of that. So folks like me that are interested in community service work and jump up into action when things are needed, folks like myself and yourself, we don't sit idle. This is the time we feel like, okay, this is our time to make a difference and bring to the conversation a necessary recovery so we can come out of this as a more formidable community, as a more formidable people. That's why the motivation on my part.
So, that's really interesting because I don't know that, and we've been talking about COVID from the beginning. We were doing this show about once a week, and then when COVID hit, I kind of pivoted and started doing the show with the the benefit of and flexibility and ease, to be honest with you, with the technology. That it amazes me how quickly we adapted. Of Zoom, we were doing it a lot more than once a week, and so we've talked about COVID quite a bit. You are actually the first person to outline it for me very succinctly as being that it was a medical crisis. It was a cultural or societal crisis. right? And also a business crisis. And it's fun. And you're right. You sitting at that sort of that crossroads. You've got, you know, the structure of your family, and sort of that is a reflection of, in my mind, would be a reflection of your kind of advocacy and community involvement in providing and improving things and improving things for people. But also you're a businessman, you're in the medical field. It's an interesting perspective that you bring to this that I didn't really anticipate. The other thing I want to ask you relevant to that is, how did it feel? Like, did that increase your need to get more like heightened in your involvement, because it is that crisis component of it? And do you feel that that is shared by a lot of people that may be in the medical profession, where a lot of the people that are in the medical profession for the first time in a long time are forced to basically engage in a different manner because the what's at stake is so much higher?
Yeah, and so absolutely. So it's a medical professional profession got hit with this first and foremost, as you know, both at a clinical level, but also at an emotional level. Because remember, a lot of our patients that are afflicted with it, you know, we are directly in line witnessing the demise, the violent nature of this disease, and now it hits multiple organs. Almost all specialty, you know, got involved in this, and of course, we all, you know, learned this or relearned the science of assessing the data, the outcomes, you know, the testing methods, and how accessible it is to people. So we were all put into a public debate on this, and you know, I had to advise our families, our communities, and we were the go-to people, regardless of whether you were actually directly seeing COVID patients or not. A lot of people relied on your advice and our, you know, ability to comfort them through this crisis. So medical professions were, you know, were definitely got in the thick of it, in the middle of it, rather instantly. So that is affected us both at an emotional level. I'll tell you, in the last 2-3 weeks, I got at least 8 calls of my patients that have passed away, and you know, then I'm inquiring about, you know, could it be COVID? I think 4 of them were COVID, and some of these were my long-term patients. I'm a neurologist, so I don't really see infectious disease or intensive care work. I don't do that up front, but these are people that had come to me for neurological reasons for years, and then now they're succumbing to this disease, you know, and this is just really unusually, you know, at a rapid pace and frequent pace. So that's affecting me emotionally, because I've known a lot of these families for a long time. So not only that, but I mean, also, you know, let's realize that that we had to, it sort of reinvigorated our own self-respect in medicine, because, you know, even medicine has been what we call in medicine, we call it moral injury. The way the physicians had been working, and the hours they had been working, and you know, and the requirements and demands on them from other, you know, entities,
right,
like administrators and performance issues. I mean, this is something that also has reinvigorated our interest in public health, public space, public safety. But like I said, both emotional and social levels, it also got us.
Well, you know, Dr. Faisal, it's interesting you should say that, because there are 2 things come to mind. You know, people are on both sides of the equation are basically blaming people for politicizing COVID because of what you just described, and because politics basically is a reflection of society's engagement with government. You know, we talk about it like it's this evil word. It defines a relationship, a contract, a social contract that we basically sign into, right, as members of a society, of a community. It was impossible for anybody to think that this medical crisis was not going, as the way it was permeating and affecting people emotionally, psychologically, financially, you know, reality of living, you know, not being able to see family members. It was impossible to think, it was completely not reality based to think that this was not going to be a bigger engagement level, right? The other thing is that, as much as that has been the case, and as much as, you know, almost to ad nauseum, we have talked about certain communities, certain members of certain professions being impacted, the restaurant industry, stuff like that, right? I have to tell you, I am still hard pressed to say that the medical profession and the impact on the medical profession, because of this 6 months almost of, you know, basically war conditions, battle conditions, right? has even been discussed to the depth it needs to be. It almost reminds me of how forever caregivers, just in senior industry, for example, it was just a given that the caregivers were there to be able to be caregivers. And nobody was talking until very recently about the emotional, psychological, physical impact on caregivers, the need for them to basically be, receive sort of, not psychological, but like emotional support, mental health support. Do you feel that we have actually really engaged with the impact on the medical profession as a society in our conversation, or not yet?
No, it's not in any narratives being discussed, right? I mean, at this point, obviously that conversation is absent. I think I agree with you. It is a valuable conversation because
Sadly, it's absent.
Healthcare industry has different moving parts, right? It's just not the physician or the hospital CEO, but you have the nurses, the allied professionals, yes, the secretary, unit secretaries that are sitting in those COVID units for 8-hour, 16-hour shifts. The exposure is immense. The risk is immense to them. And also all the downstream services that are affected, infusion services, home care services. And, for everybody has lost economically something, some more than others. And we haven't really spoken of the emotional toll at all, psychological toll on service providers. Because
isn't that fascinating though, Doctor? I mean, it's fascinating because we had this whole sort of like a little bit of a little bit of an upswing of, essential workers, essential services, first responders. And it was like, we salute first responders, we support first responders. Okay, now we're moving on to the other topic. But it's really funny. It's like because the reason why we're even taking time right now to discuss this is the impact and effect, correct me if I'm wrong, the impact and effect psychologically, emotionally, financially on these people that are on the front lines dealing with this. And it wasn't a weekend excursion. It's been 6 months. It's likely to be another 6 months, right? At least. These people are going to have ripple effect impacts going forward. And how do we as a society address those? Or do we just sweep them under the carpet and say, oh, that was 2020?
Right. I mean, one of the issues is we had case examples of nurses or LVNs, which is secondary nurses, support staff going into these elderly care units, and if they wouldn't show up, they would get fired. If they protest that they don't have proper protective equipment, they would lose their jobs. And some whistleblowers came out, but it didn't become a national debate about what's the ethical responsibility of administrators to provide that.
Imagine if we said to the soldier, you have to show up to the battlefield and go into the front line, and you go, well, I don't have a weapon, hasn't been issued to me, I don't have protective gear, and well, if you don't show up, you're basically going to be court-martialed. I mean, it's
that, and then the number of health professionals that have actually succumbed to the disease and have died. It's not a small number, more so in Europe than America so far, but it's still a significant number.
So I think we have established why you felt, after years of being involved in community outreach and engagement, that it may be something where you need to step up like you said, you scale up your involvement to where maybe you were sitting in a little bit more of a policy impacting position. And so tell people that don't know about District 2 in Fullerton. I mentioned in my opening that, Fullerton is one of those cities in Orange County that is been districted. And so if you won't mind, just give people a little bit of a sense of your community.
Yeah, so Fullerton is going to first time really have district-wide elections in a sense. Last cycle was a sort of a partial encroachment into that. This is the first time when 3 out of 5 districts are up for election with no incumbents. My district, District 2, it's north of Fullerton. It is the only district that we have actually technically 4 candidates running. The other 2 districts only have 2 competing. This district is mostly residential. We have very little, commercial real estate here. Mostly residential, single-family homes. Larger homes tends to be the more affluent district. It is more elderly, with less homes have kids at home. It's about 20% Asian, perhaps 10, 20, 15% Latino, and mostly elderly, majority white district. Tends to also be a little bit more conservative, compared to other districts. But it's a good community. We moved here because we wanted to raise our kids in a culturally rich environment. This had things. opportunities for kids, for growth. My kids even, they had special needs. There were special needs kids because we had adopted them. So we needed a place where schools could offer multi-age programs like this in this area. We did, so they can have emotional stability, and we achieved that. We found it to be a great place to raise family, a very safe place. And those are the features of this community that it's a sense of community, that I would really cherish. I mean, I have a church on my street. I don't go to church, but I have a church on my street, and you don't have that concept anymore in America, right?
Right.
The neighborhood where you have the spiritual and communal life that can revolve around something. So I found that really beautiful, and you see a lot of that element in the community here.
So that also sounds to me, I mean, it's beautiful. I mean, you painted a very nice picture of what your community and why you cherish it or you enjoy being there. But also what you did say to me is that there's a large bunch of people that are, long-term residents, long-term owners, or long-term residential, right, owners. I'm going to let you basically discuss it, but I want to go down the path of, well, okay, so what does this picturesque, almost Mayberry kind of description that you just did, what are some of the issues? Because again, it's districted, right? So twofold, two questions. One, what is like a place like District 2 in Fullerton? It sounds like Hunger Games. District 2 in Fullerton basically have, as far as issues that you are running on, right, that are meaningful into your immediate local, two degrees of separation community, but also you opened up the door sort of for me in saying that Fullerton, which is true, this is the first election season or cycle where it is fully district elections. Because last time, a common friend of ours, Ahmed Zahra, basically, that was a district, that was the first time for I think it was a District 3, I think Ahmed's in District 3 maybe. So how does that play out? Or how do you anticipate that's going to play out for people that forever have been used to voting across city? Now, basically, they're being asked to vote, in their district. Explain to people, because not a lot of places in Orange County have that yet. A lot of places in Orange County are at large. Explain that to people, and explain that how that has basically maybe played out in your strategy for your campaign.
So we have some of the brief input that I have received is that not too many people are critical of it, but some people are very concerned about it. And some people are critical of the districting, and they would have seen, and they would have liked an opportunity to be able to vote broadly for all the candidates.
What is their concern based on? I mean, I can anticipate your answer, but please, what's their concern, you think, based on?
I think right now the concern arises from just the present representation at the council. I think it's a general dismay from the current representation and lack of transparency. But I think we haven't yet experienced fully districted elections, so I'm not sure if this concern is really fully validated yet. But I think people would have liked to vote for, some people would have liked to vote broadly. But the way it changes a campaign, though, it's very interesting because number one, it becomes a little bit manageable.
Sure.
Especially somebody like me who's going to maintain this full-time practice. So I can focus on the issues of interest of the district.
Yeah, you're not running all over town. You're not having to cover all over town. You're not having to sell yourself all over town or hold these meetings all over town. Your area is really District 2.
Although personally, I don't want to ignore that component because the city has to operate as a city. But I think if the district has specific issues, like for example, we have infrastructure is the biggest issue citywide. So it is number one on my platform. We need to repair our roads. We need to, repair the pipes and water main lines because things keep breaking too often. But also for me, because I wear public health hat, the repairs that we do have to be critical in recognizing that they have to be safe for our elderly to be able to walk with a walker. Because when my institution, St. Jude, receives one of its largest admissions is elderly injuries.
Sure.
And so we need to create that. So we have data on that. So we have an interest in creating a very safe environment. Second biggest issue on platform is economic recovery. So this is every city is dealing with deficits. This is going to be part of our sort of culture in terms of our discussions at the policy level for the years to come. But we need to come out of this in a robust way. We need serious economic recovery, and we cannot get it fast enough. So we need to figure out, we're in conversations of what cities can do to make sure we enhance it, facilitate it. And my third biggest platform issue that's really that resonates in the district, in a significant way, is public health and safety of the elderly, the adolescent, mental health. Fullerton still ranks higher in Orange County for heroin addiction and opioid crisis related issues. So those are the critical things that I'll be the one that in my position allows me to be an advocate for, not just for the district, but really for the whole city.
So, you know, it's interesting is because I oscillate, okay, because it's such a new idea kind of for Orange County. And I always look at who's pushing it. Like if a city basically goes into, like, somebody's basically trying to get districts to happen, I always look behind the curtain. I always try to figure out why is it that that particular entity is trying to force this, right? And to be honest, not all the time is it a benevolent effort that's in the best interest of the community. Sometimes it's a manipulative special interest approach to try to, whatever, green light, fast track, whatever, or try to regain some control that maybe seems to be lost because of the changing culture in the community. Whatever, be that as it may, what I think is interesting about what you just shared, and thank you for doing that, is that if you are living in a district in Orange County where you are now being asked to vote on a district, I totally get the frustration and the level of angst and whatever, because you're being asked to do something completely different from what you've done forever, right? You're being now told, no, you get to vote for your person only. But if you just flip the other side of that coin and go, okay, so I get to vote for only one person, but it's actually even more super critical that that person from your district is now the right person, because really they are going to be your instrument, if you will, to pursue the larger citywide efforts. Like you're not going to basically just fix the pipes. And I know you guys have an issue with the pipes in Fullerton, just because of age, right? And the repairs and the sustainability of the repairs and all this stuff. But, you're not going to fix the pipes in District 2 only, or up to District 2, and then basically, that other council member didn't really support it. If you are a resident of a district, I think it is now even more important that you educate yourself about who your candidates are and what they can do to wear multiple hats, because they're going to be your only, your quality control, your double check system on the larger issues. And so that, you immediately shifted. You're like, yes, I'm from District 2, but I also understand that my responsibility is to be engaged in with the council at large on that. I think it's a very fascinating growth for Orange County as a whole, for those areas that have districts, because I don't know that we're done. I think there's going to be a lot more efforts in different cities to do the same thing in the future.
And I think, from a campaign perspective, it's helpful, because one of the things we want to ensure is that we don't keep playing that game where city council races in terms of money, it gets to the point where once assembly races were, you don't need millions of dollars. I think the containment of that is that you can do more with less money, reach out to people. And just like congressional districting is as good as your representative being able to advocate that those neighborhoods' needs. May not win all the votes, because everybody's representing a different district. But I think people you want to elect, you want to make sure that they understand the district, but also understand the city has to operate as a whole.
Well, and like I said, given what's been going on recently, given if I had lived in District 2, I'm just using Fullerton as District 2, but it could be any district. If I was living in the district, if I was I am in San Clemente, if I was voting in a district, part of me would be basically very agitated that I don't get to weigh in on the other districts. Like, wait a minute, for the last, what have I been in San Clemente since '87? For the last oodles of years, I basically have had to, I have had the say in every person that was running, whether I was going to vote for them or not. So it really makes it a much more focused, actually, vote, which is really interesting, because I never really thought about that until we were just talking here, right? And I really now basically measure the quality of the candidate that I may vote for, because that is my representative to the city.
Yeah.
It's like when we vote for a congressman or a senator, right? That is my region's representative to the Congress or the Senate. It's kind of the same thing. And I do like the idea that it is not this endless pit that sucks up money every election cycle, because when that becomes the drive for the candidate, that becomes the drive for the campaign, is that we just have to basically stay ahead of basically being in the red, right? In order to to last a marathon of running, it takes away, I think, from the spirit of what we're trying to do, which is basically elect people that bring quality, character, credibility, credentials to do the job. It is the job. It's not the seat. We keep voting people into a seat versus into a job. And the opposite side of that, if it's not districted or if it's not limited in terms of the run, that's why I think in a lot of cases, that person, like in your case, you get elected to District 2. Next election cycle, if you're running for re-election, you are not going to have to start building your coffers from day one that you're in the seat.
Mm-hmm.
Like, it's still a controlled area.
Mm-hmm.
It's still a manageable representation. And then while you're doing the job, even though you may have an outreach to the city, maybe it's through the mayor or whatever, but your primary responsibility, just like your primary responsibility as a physician, would be to your patients. Your patients are the residents of District 2.
Right.
So it actually is a healthier way to go about things, because we've tried the other one and it seems, and I can't even believe I'm saying this, Faisal, honestly, because up till this point, I have been like adamantly like no districts, because I know who's pulling the strings in some cases. And I'm like, no, I'm not letting you win this one. But so that's really very cool. So you have an elderly population in your district because these are people that are longtime residents, right? So that appeals, to your responsibility as a physician, as a neurologist, because I mean, my father is 84. Let me tell you, we are in direct communication with our neurologist quite often, right? And then he has got a bit of a dementia. So it's, again, these are very critical people in that. As a physician, I love your campaign slogan of the build, serve, and heal, by the way. So tell me a little bit about that. How did that come about?
Well, that comes about from, my years of work and my personality, because, what I did is all these years that I've been engaged in building my business as a healthcare business owner, building nonprofits, and for the sake of community service. So building for me relates to the building component of my platform, which is building infrastructure, rebuilding it. And then serving is my long record of community service with reaching out to people. I got, and I'm really blessed to actually be even to share this story. When the pandemic hit, all I did is I wrote a letter to all my neighbors. I said, if you're an elderly or if you're a single parent who is not willing to or unable to go to the grocery store, here's my cell number. Please call me and I'll just go do that. And somebody put that on Facebook, that letter, a copy of the letter. So then I started getting these calls. People wanted to volunteer. And then we created a ragtag group of like 30 volunteers on WhatsApp. We assigned a intern to it. And then next, working with St. Jude and other organizations in the area, we ended up serving about 100 seniors in the next few weeks, and just bringing supplies and groceries to them. And it was a short-term project, but it just, I'm the guy who gets active, and when it comes down to for call of service, I'm energetic enough, young enough to be able to put my energies.
Well, you recognize something from your professional capacity. You saw the thing where a need was going to be there, and you took action at a grassroots neighborhood level because there was a need. And you felt that you could maybe help in a capacity, and then that basically became inspirational to other people. I think that's a wonderful story to share. So thank you for sharing that. Yeah.
And then comes the idea of healing after that. Healing is part of my profession. So I do think we're going through a transformation in this country where there's a lot of contentious issues. I mean, I think my job has always been to heal the wounds. And I think that's my philosophical perspective, is that I feel like
be they physical, emotional, or cultural. I mean, I think that's a very, very good word to use, because I agree with you. We are in need of healing. We are in need of unity versus divisiveness. And without getting too much on the national platform, at the end of the day, it all trickles down to our neighborhoods and our streets and our blocks. So I totally understand it. I do want you to talk a little bit about, because I'm very intrigued. Tell me about mindsnetwork.org.
Minds it stands for Medical Network Devoted to Service. It's a nonprofit that I co-founded going back almost 9 to 10 years ago. And this was in the middle of a healthcare crisis where people were really suffering from lack of care and access to care and unaffordable care. And at that time, the goal was to provide charitable free healthcare by creating a network of physicians in the area to those families that really did not have access to it. So over the last few years, we have successfully been able to serve many families and patients. Now our focus is, in terms of general healthcare provision, our focus is really shifted to more neurological disabilities. And so with the help of my large healthcare group, we're focused on needs and issues of patients that are afflicted with long-term neurological conditions. But this has been a very rewarding experience. Through this MINDS model, we were able to do a lot of service projects, get out in the communities. One of my pet peeves always was that a lot of the healthcare outcomes are determined by social setting and the social issues. So when we founded the organization, we got together brainstorming. I told the team, we need to get into people's homes, meaning we need to get into the mindset to see what they're dealing with. And this is the one way we really heal, their other healthcare needs. And that's really what led to this. And we were successful enough to serve hundreds of families since then.
So what do you mean by getting into their homes? Are you talking about like going beyond the immediate need, like going into more of a sustainable way, like the more you know, the more you can sustain the positive impact of whatever you may do to improve their lives?
Right. So, for example, we had a client or patient who was going to undergo renal transplant, kidney transplant, which was going to be in San Diego. And one of the problems with this patient was that he couldn't get there because he didn't have the place to stay necessarily there, before and after. Yeah. So that's a need that, nobody really has thought of, had not thought of till the case came to our attention. So we helped facilitated for him a place to be comfortable there before and after. So those are the kind of elements that are in the periphery of healthcare that we were able to help support, folks to get the proper care they need.
Yeah, you know what? It's very similar to, like, for example, what Ronald McDonald House does specifically for parents of kids that are basically, going to, whether it's chalk or wherever the kids is, it's a place for them. Because, and I know a bunch of people at that organization, a bunch of people that actually have benefited from that organization, and it's a genuine help when you basically take care of that component, because then, especially in the case of, like you saying, a surgery or something like that, the patient, the family, the support system can focus on the actual thing that they're there for and not be worried about all this other stuff. I want to talk a little bit wider, because you and I kind of talked about it a little bit, right? Whether it be Fullerton and District 2, whether it be Fullerton, whether it be Orange County at large, there are some common issues that we are all either facing or we're going to be facing as a community quite soon, okay? Mm-hmm. And a lot of it has to do with, call them elderly, whether they call themselves active adult, but I don't think they want to call themselves seniors anymore. But let's talk about that, because we have a community that's aging. We have a county that's aging. We have a change of dynamics because of that impacts everything from how we basically benefit from our payroll taxes, our sales taxes, our housing prices, all of that stuff, right? Mm-hmm. Do you feel that in your role as a city council member, that you and your background in terms of community involvement and advocacy, do you feel that this is something that we are prepared for? Or is it something that we really need to kind of get our attention on?
Well, I mean, so for elderly care, we're not prepared for it. California's Commission on Aging has put out some great reports, both on elderly justice and what they call the roadmap for elderly care. The master plan is what it's referred to. Yeah. It's got great data, great information. We want to transform that into policy, both at the county level, city level. County, for example, runs the healthcare of all the cities here, essentially. So county is a very incredible, component of it. For me in the city council, and being connected in the healthcare field, I can a little bit more easily navigate the system of healthcare vis-a-vis county. So I can be there to advocate for our elderly and active adults. But really, elderly care requires safety first. Their safety is critical, both from injuries, from abuse, from scams. And I think that's where a lot of the investment needs to go through, because all that stuff is going to be exponentially growing. All the adverse sort of these adverse elements in and around the elderly as the elderly population grows. So it is going to be a lot more to manage, a lot more to handle, a lot more funding needs where the funding is simply not there.
Yeah, I agree. I agree with you. And people say, well, why do you keep harping on this, Raad? Well, in part, the Raad life is, start off as a journey of aging or talking about issues like that. And we've been very blessed to have a sort of a front seat to an early, preview, if you will, or a trailer for what's coming for 5 years now. And it really concerns me. Plus, there's another kind of a selfish part to this, right? I'm 54 years old. I don't really, and I have a father who's 84, and I'm dealing with this from a first person, level, first degree level myself, and not take away from my sister either. She's very much an instrumental part of what we've been able to do for my dad. But I really worry, because if you're fortunate enough to have the means, the ability to build that infrastructure based on your personal needs as these things appear, it's still very difficult. It's still very emotionally draining. It's still you can't just snap your fingers and basically it's done. It takes a lot of effort, coordination. I've been learning about this stuff for the last 5 years, and I still didn't know enough. And so I worry about the people that don't have those means, the people that are in our responsibility. I am my brother and my sister's keeper, right? So it's, and it worries me. So I appreciate hearing you say that, because I do believe that the strongest advocate for this would be at the city council, and that would basically be what really needs to be heard at the county, because the county has other things that draw on it. At the end of the day, things get prioritized. But if we're not ready for this, which we are not, you and I agree on this, it's like a tsunami. I mean, they call it a silver tsunami. The last time a tsunami hit the coast of Florida, there was a lot of damage. So it's not all, we're in California, we're thinking, oh, it's a tsunami, cool, man, there's going to be some cool waves, we're just going to catch some cool waves, right? Yeah, but there's also going to be a lot of damage if we're not ready for that tsunami. Dr. Faisal, what are you doing right now? Where can people get a hold of you or come and hear you? I'm assuming you're doing a lot of stuff, obviously, virtually.
Yeah, so this campaign is very, very unique, but it's my first campaign ever, but it's interesting. It has the pros and cons, of course, but a lot of it is a Zoom campaign. We're doing a lot of discussions where I have created a platform for people to come and give the input, because I think it's time to listen to people. So every Tuesday evening, we're doing a platform, town hall, sort of platform for people to come and join. Our Facebook webpage is where we advertise a lot of that, but our own website, which is votedrkazi.com, has a lot of resources for folks. But you mentioned about a manageable district. Here I'm comfortable, I have my email to all the 16,000 voters, and I'm very comfortable in having all 16,000 voters can directly get a hold of me, because I can manage at least responding to the concerns to as many of those who are interested in reaching out. It becomes a little difficult, of course, if it's the entire population of a city. But please, we want people to engage in local issues. So one of the goals is to educate people on local issues in terms of to get them excited about it, get them interested into it. I just don't want the national mood and national election and mood around the national election to really define all the conversations that go on here in our cities. I think there's a lot more. I tell people, if you feel like you're not feeling the national candidates, just know that your vote is very, very powerful when you start dealing with your assembly people, your county supervisors, when you're city councilmen, your school board members, then you'll see really the power and impact you can make directly. And this is the education we need to provide to voters so that they don't get discouraged.
Well, and the political process for a voter can seem overwhelming sometimes, right? And especially, coming off the tail end, or not the tail end, but being in the midst of a pandemic where you're worried about your safety, you're worried about now I'm ordering all my groceries, I can't even go to the grocery store. You're concerned about if somebody coughs near you. I think that the sense of stress and overwhelmingness actually is very much part of our daily life right now, more so than it was before. And for things that are out of our control, we don't really have an ability to basically turn on a switch and say, okay, it's over right now. Right. So you're right. It could become very overwhelming, and then the noise from the national level is distracting as well. And in the course of that, just basically decide, you know what, I'm just in like almost post-traumatic stress disorder. I'm going to sit in the corner of my room and rock and forget it. I'm not going to vote. That is a very real risk as far as I'm concerned in November. So kudos for you for keeping the focus on what is manageable and where your voice can really count, which at the end of the day, all news, all policy is local policy, all news is local news. If you make one decision that you can feel, or spend energy to make one decision this election cycle in the midst of being overwhelmed by everything else going on, you get to decide who represents you at the first gate, right, of policy, your city council. And that is a decision you should take very seriously and spend the energy to know your candidates. So you said there's 4 candidates running for your district?
Yeah.
Wow.
We're the largest one.
So it's your first run for office. It is 4 candidates, which is the largest number of people running in the districts in Fullerton. Right. It's a pandemic.
Yeah.
Nothing like jumping into the deep end of the pool.
Well, but I'm used to the first, in a sense that, I'm blessed with the opportunity to create programs that had not existed before. So it's in itself very exciting to be able to do that. I'm the last candidate to jump in the race. But I'm convinced that we are making strides and making the impact. If nothing else, we have the requisite outreach to really educate people and get them interested. And one of my goals is to really get people interested in local affairs and not the national mood define, what they feel.
The thing I do know about you, Faisal, is that regardless of the outcome in November, your continuing engagement and involvement to make things better and to leave people better than you find them isn't going to end. That will just continue to, I really love the way you just said, scale up. You're going to continue to scale up, right? I don't think I've ever heard anybody refer to community involvement as a scale up. Usually it's like, oh my God, no good deed goes unpunished. Here's more for me to do. But you will continue to scale up. And if I was in District 2, I'd be voting for you, because District 2, I think, is very lucky to have you as somebody who's willing to step up and put yourself in the ring. And it is politics can be a blood sport sometimes. Yeah, sometimes. So I really appreciate you taking the time to spend some time with me. Let's give people, again, the website for your campaign. I don't have it on the screen, but give people the website again, please.
Yes, it's www.votedrqazi.com, which is DRQAZI.com. There's no U after the Q. That's a grammatical thing, but it's www.votedrqazi.com.
Well, Dr. Q, I appreciate you being on, and again, wish you all the luck in November. And I, as always, will be watching what you're doing. But I really appreciate you stepping up. I always do, regardless of what. And as much as we like to always believe that city council elections, that I purposely did not mention it before in the show, but are a nonpartisan situation. They tend to get a little bit contentious and tend to be a little bit more party. But I really believe that they should be nonpartisan. And you have made a believer out of me in terms of the districting process, because if there's candidates like you that are running for districts, I can definitely get behind the districting process. And that is a big thing for me to say, let me tell you.
That means a lot.
Yeah, it really is. I'm a convert. That doesn't mean I'm not going to check what the heck is going on in districting, but I wish you luck, my friend, and keep doing what you're doing. You're doing great work. And for anybody who is also interested, please check out Dr. Qazi's mindsnetwork.org. It's a great initiative. They do really wonderful work. And hopefully you will come back and we'll talk to you again after you're at City Council, or, to be honest, regardless. So I'd love to have you on again. You're always welcome, my friend. And I wish you, again, good luck in November.
Thank you so much. And thanks for having me.
My pleasure. Thank you.
Bye-bye.
Bye-bye.